5 well-organized multiple-choice questions are presented in this video. Each multiple-choice question covers the following topic. Number 1. Diagnosis of Epstein-Barr virus infectious mononucleosis. Number 2. Diagnosis of herpes zoster. Number 3. Diagnosis of glucose-6-phosphate dehydrogenase deficiency. Number 4. Adenoid cystic parotid carcinoma presentation. And number 5. Signs of puberty.
A 19-year-old man presents with a 1-week history of malaise, anorexia, fever, and sore throat. Exam shows inflamed throat without exudate, palatal petechiae, cervical lymphadenopathy, enlarged liver, 12 centimeters, and palpable spleen. Throat culture is negative for group A streptococci. Labs reveal mild anemia, reticulocytosis, leukocytosis with lymphocytosis, elevated bilirubin, LDH, AST, and ALT. What is the best initial test to order? A. Liver biopsy and hepatitis antibodies. B. Streptococcal screen and ASO titer. C. Peripheral blood smear and heterophile antibody. D. Toxoplasma IgG and stool exam. Or E. Lymph node biopsy and CMV serology.
The correct answer is C. This patient's symptoms and signs, fever, sore throat without exudate, palatal petechiae, cervical lymphadenopathy, hepatosplenomegaly, lymphocytosis with atypical lymphocytes, and elevated liver enzymes are typical of Epstein-Barr virus infectious mononucleosis. The heterophile antibody test, the monospot test, is the best initial diagnostic tool, and the peripheral smear confirms atypical lymphocytes. Other options? Liver biopsy and hepatitis antibodies are unnecessary due to mild liver involvement. Streptococcal screen and ASO titer are unlikely since the throat culture is negative and there is no exudate. Toxoplasma IgG and stool sample do not fit the clinical picture, and lymph node biopsy with CMV serology is invasive and not a first-line approach in this case.
Multiple choice question number 2.
The painful rash that an 80-year-old female patient has been complaining of for 3 days now has spread from the right side of her forehead all the way down to her right eyelid. When looking at the patient physically, you can see weeping vesicular lesions. After reviewing the symptoms, which diagnosis do you think is most probable? A. Impetigo. B. Adult chickenpox. C. Herpes zoster. D. Coxsackie-A virus. Or E. Herpes simplex virus.
The answer is C. Herpes zoster causes a painful vesicular rash that follows a specific nerve distribution, often involving the ophthalmic branch of the trigeminal nerve, which affects the forehead and eyelid. Early signs include pain and rash restricted to one side of the face. Timely antiviral treatment such as acyclovir, valacyclovir, famiciclovir helps shorten symptoms and reduces the risk of nerve pain afterward. Other conditions like impetigo cause more diffuse skin infection without nerve-specific patterns and usually less pain. Chickenpox causes widespread itchy vesicles at different stages. Coxsackie virus affects palms, soles, and throat, while herpes simplex typically causes cold sores, not a dermatomal rash.
Multiple choice question number 3.
A 6-year-old Mediterranean boy presents with sudden dark urine, pallor, and fatigue. 3 days ago, he had a fever and sore throat treated with a new medication. Exam shows jaundice and splenomegaly. Labs reveal hemoglobin 7.5 grams per deciliter, elevated reticulocytes, bite cells, Heinz bodies, and a negative Coombs test. Which of the following is the most likely diagnosis? A. Autoimmune hemolytic anemia. B. Glucose-6-phosphate dehydrogenase deficiency. C. Sickle cell anemia. D. Hereditary spherocytosis. E. Paroxysmal nocturnal hemoglobinuria, PNH.
Correct answer. B. This child presents with acute hemolysis triggered by oxidative stress, likely from infection and a new medication. G6PD deficiency is an X-linked disorder common in people of Mediterranean descent. It leads to red cell vulnerability to oxidative agents, resulting in hemolytic anemia, characterized by Bite cells and Heinz bodies on the smear. Negative Coombs test differentiates it from autoimmune hemolytic anemia. Sickle cell anemia presents with sickled cells. Hereditary spherocytosis shows spherocytes. And PNH has intravascular hemolysis with hemoglobinuria, but no Heinz bodies. Management includes avoiding triggers, supportive care, and monitoring hemolysis.
Multiple choice question number 4.
A 63-year-old man develops a swelling in front of his left ear, which is gradually increased in size over 4 months and causes local discomfort. Examination reveals a firm 5-centimeter swelling near the tragus with restricted movement. The left side of his mouth moves less than the right, causing an asymmetric grin, but his eye closure is even. What is the most likely diagnosis? A. Warthin tumor, adenolymphoma. B. Pleomorphic adenoma, superficial lobe. C. Adenoid cystic parotid carcinoma. D. Pleomorphic adenoma, deep lobe. E. Chronic parotitis.
C is the answer. A focal parotid tumor causing partial facial nerve paralysis indicates malignant infiltration, which is pathognomonic. Malignant infiltrated tumors, such as adenoid cystic carcinoma, specifically invade surrounding tissues and nerves, causing facial nerve weakness. These tumors are rare but aggressive, requiring total parotidectomy. Despite surgery, they frequently recur and metastasize to lymph nodes. The prognosis is generally poor due to their infiltrative nature and tendency for local spread and distant metastasis. Benign tumors like pleomorphic adenoma or adenolympomas grow slowly and displace the nerve without causing palsy, even when large. Non-malignant causes, such as parotid duct stones, mumps, or bacterial parotitis, cause pain but never facial nerve paralysis.
Multiple choice question number 5.
A mom takes her son, who's 13 years old, to the doctor, worried that he is falling behind in development compared to his elder siblings, inquiring about the onset of puberty. When deciding whether or not his puberty has begun, which of the following would you say is the first sign? A. Pubic hair development. B. Axillary hair growth. C. Enlargement of the penis. D. Development of the testicles and scrotum. E. Voice deepening.
D is correct. The first sign of puberty in boys is the enlargement of the testicles and darkening and thinning of the scrotum skin. This usually occurs between ages 9 and 14 and indicates the start of gonadal puberty, when the testes produce testosterone, which drives other pubertal changes. Pubic hair development follows, along with growth of the penis, appearance of axillary underarm hair, and later voice deepening. Facial hair and other body changes happen in further stages. Testicular enlargement is the earliest and most reliable sign to assess the onset of puberty in boys.